Ever wondered how to recognize the warning signs of a heart attack or stroke? Today, we're going to delve into this crucial topic. Heart attacks and strokes are medical emergencies that can strike anyone, anywhere, at any time. They're among the leading causes of death worldwide. But if the signs are recognized early and the victim receives immediate medical attention, the odds of survival significantly increase. For heart attacks, look out for symptoms like chest discomfort, shortness of breath, and pain in the upper body. Stroke signs, on the other hand, might include sudden numbness, confusion, trouble speaking or understanding, and severe headaches. Knowing these signs is not just for your benefit, but also for the people around you, because when it comes to heart attacks and strokes, every second counts. Understanding these signs can be the difference between life and death. So, what should you be looking out for if a heart attack is happening? Let's delve into the symptoms that one might experience during a heart attack. These signs are not always the same for everyone, but there are certain commonalities that you should be aware of. First and foremost, chest discomfort is the most common symptom. This isn't always a sharp, stabbing pain, as often depicted in movies. It could be a sensation of pressure, squeezing, fullness, or just plain discomfort in the center of the chest. This sensation often lasts more than a few minutes. It could come and go or persist steadily. In addition to chest discomfort, shortness of breath is another key sign. This can occur with or without chest discomfort. You may feel like you've just run a marathon, even if you've been sitting still. You'd also want to watch out for discomfort in other areas of the upper body. This could include one or both arms, the back, shoulders, neck, jaw, or even the stomach. This discomfort could feel like a dull ache or a sharp pain. Other symptoms might include breaking out in a cold sweat, feeling unusually tired for no apparent reason, nausea, or lightheadedness. It's important to remember that not everyone who has a heart attack experiences these classic symptoms. Some people may have a silent heart attack, which has minimal or even no symptoms. This is especially common in people with diabetes. Also, women in particular may experience atypical symptoms, such as shortness of breath, nausea, vomiting, and back or jaw pain. So if you or anyone around you experiences any of these symptoms, don't dismiss them. Time is critical when it comes to a heart attack. Call for medical help immediately, even if you're not sure. These signs don't always mean a heart attack, but it's always better to be safe than sorry. Now let's move on to the signs of a stroke. Now, what if it's a stroke? What signs should you be mindful of? Let's delve into this important question. A stroke, also known as a brain attack, happens when blood flow to a part of the brain is blocked or when a blood vessel in the brain bursts. This can lead to severe consequences, and understanding the signs can help you act swiftly. One of the most common symptoms of a stroke is sudden numbness or weakness. This often occurs on one side of the body. It could be in your face, arm, or leg. So, if you notice a sudden droop on one side of your face, or if you can't move one of your arms or legs, it could be a sign of a stroke. Another significant symptom is confusion. This isn't just forgetting where you put your keys. We're talking about sudden and severe confusion, trouble speaking, or difficulty understanding speech. A person experiencing a stroke may slur their words or have trouble forming coherent sentences. Vision problems are also a common symptom of stroke. This could be trouble seeing in one or both eyes. It could manifest as blurred vision, blackened vision, or seeing double. If you or someone else suddenly has trouble seeing, it's a major red flag. A less known but equally important symptom of a stroke is trouble walking. This could be due to dizziness, loss of balance, or lack of coordination. If you find yourself or someone else suddenly stumbling or unable to walk straight, it's time to act. And then there's the severe headache. This isn't your run-of-the-mill headache. It's an intense, possibly the worst headache you've ever had, and it comes on suddenly, without any apparent cause. These symptoms may appear alone or in combination, and they can occur quickly or progress over hours. The key thing is that they're all sudden. That's why strokes are medical emergencies. Just like with heart attacks, these signs should always be taken seriously. Time is of the essence when it comes to strokes. So if you notice any of these symptoms, don't wait. Call for help immediately. Recognizing the symptoms is the first step. Now, what action should you take? When the warning signs of a heart attack or stroke appear, every second counts. The most crucial action to take is to call for emergency medical aid. Don't hesitate or downplay the symptoms. It's always better to be safe than sorry. When you call for help, be ready to describe the symptoms as clearly and accurately as possible. This can help the emergency operator understand the urgency of the situation and provide you with life-saving instructions while you wait for the paramedics. If you suspect a heart attack, the operator may advise you to chew and swallow an aspirin if it's available and you're not allergic. Aspirin is a blood thinner that can slow down the clotting process, helping to maintain blood flow to the heart. But remember, only take this step if advised by a healthcare professional. While waiting for medical help, try to stay calm. Panic can increase heart rate and blood pressure, which might worsen the situation. If you can, sit down and rest. Try to avoid lying flat, as this can make it harder to breathe. If you're with someone who's experiencing these symptoms, reassure them that help is on the way. If they lose consciousness, start performing chest compressions and rescue breaths, if you're trained to do so. In the case of a stroke, time is even more critical. The longer the brain is deprived of oxygen, the greater the damage. Immediate medical attention can minimize this damage and increase the chances of a full recovery. Remember, these actions are not alternatives to professional medical help. They are meant to provide temporary relief and increase the chances of survival until help arrives. We hope you never have to use this information, but if you do, it could make the difference between life and death. So, let's recap. Recognize the symptoms. Call for emergency help immediately. Describe the symptoms, take an aspirin if advised, and try to stay calm while waiting for help. Remember, quick action can save lives. Time is crucial in a medical emergency.